Hi guys, it's Dr. Karen and I'm here with my bestie, Dr. Juta.
Hello.
So Juta has been practicing as a medical doctor in Germany. She's an obstetrician and gynecologist and she's been in Germany for over 10 years. So she has experience with navigating working in Germany, and today she's going to share with us, those of you who want to jackpot, do you know what jackpot means? So jackpot means that you are migrating. So those of you who want to migrate for work in Germany, I mean people in the medical field, well, she's going to give you all the tips you need.
Okay.
Roll away.
So first of all, it's not such a straightforward process. You first have to learn the language, and the language, there are different levels of the language. So we start from A1, A2, B1, B2, and for doctors you need to get to C1. And even if you do C1, you still need to do German in the medical language. So that is also another certificate. And when you are done with that, then you write the exam for your work permit.
So I'm sure a lot of people will want to know, can you learn the language like the German in your home country, or you need to start and then come and complete up to the highest level in Germany?
You can learn everything here, but even if you have the certificate and you can't speak the language, or you don't make an effort to speak the language, then it's very difficult. You have to believe that you can speak the language because you're a doctor and you should be able to communicate with your patients.
Can you say something to me in German?
Like,
I love you.
Ich liebe dich.
Ich liebe dich. My viewers, is liebe dich. Okay, so what's the next step after you've learned the language, or like what's not necessarily the next step, but what else? What other tip do you have?
So what helped me was there are courses where it prepares you for your exam. Even if you finish with the language, you can try to learn on your own. It can be a bit difficult. So you can either take part in a course, or you look for a group of people also writing the exams, and then you study together, because this entails everything: medicine, surgery, a little bit of pharmacology, a little bit of anesthesiology. It's almost everything, and everything will be done in German. So with the exam, you have a day where you just do the clinical work. You have a patient, you're supposed to take your history, your diagnosis, and then at the end you write a discharge letter or a referral letter, what you send to your doctor. And that is one aspect. And then the second aspect is the oral exam. There you meet with a panel of doctors, in total 3, and it's usually in relation to the case that you had. So even if you had a medical case, it's possible that you will be asked questions in surgery or anesthesiology or pharmacology, depending on what examiner you have.
So is there any way like you can know who your examiner is? So maybe you're going to, okay.
Actually, yes, depending on also the region you find yourself. There are people who get the names of their examiners maybe like some days to your exam date. But my region, we had 2 weeks notification that you'll be examined by these 3 doctors. Then you have the chance to look for their protocols, study them, and then they usually have specific questions they ask, and that helps also sometimes.
Okay, so is it also helpful? I remember you were also doing some rotations in hospitals and all that. Is it?
That's a tricky one. Yes, to help you practice your language, yes, you can do that. It can be helpful. But most of these rotations you do, normally end up doing a lot, and it's kind of underappreciated. But you have a target, or you have a goal, and the goal is to pass your exams or to become more confident and fluent in the language. And that you can achieve doing the practicals.
I think these are awesome tips. Do you have any more? These are your top tips for people who want to jackpot for medical reasons to Germany.
After you've managed to do all this, I mean, the most important thing, just speak. Okay, we all make mistakes. Even in English, in your mother tongue, you make mistakes. Just be confident and speak. If you don't speak, you never get good at speaking the language. So that's what I can advise you. And after everything is done, it's quite easy to get a job because doctors are needed everywhere.
All right. So thank you so much. She's shared important tips. If you need any information about coaching for medical training or medical work experience in Germany, I will leave her handle. You can send her a DM. She does medical coaching for people who want to migrate. She's not a consultant, it's advice, and it's not free, so you have to drop some cash for that. Okay, so catch you later, and thank you so much, Juta, for joining us.
You're welcome.
Bye.
Auf Wiedersehen.